Welcome, everyone. Welcome to the launch of the Food is Medicine Institute. My name is Dariush Mozaffarian. As the inaugural director of the Institute, I'm honored to welcome you, both folks in the room in our packed auditorium, but also the hundreds of people who are joining us online. Thank you for joining for this live stream for this really exciting event. I'm just going to open with just introductions of four really remarkable people who are providing opening remarks about what we're doing here and why we're doing it today. First, you're going to hear from President Sunil Kumar, the 14th president of Tufts University. President Kumar assumed office of July 1st of this year, coming from leadership positions at Johns Hopkins, at the University of Chicago, and at Stanford. His own scholarship, quite appropriately for today, has investigated how one can build and influence systems to achieve societally valuable outcomes. I'm deeply grateful to President Kumar for his leadership and vision in supporting the establishment of the Food is Medicine Institute. President Kumar.
Good afternoon, and thank you, Dari, and thank you not just for the introduction, which is undeserved, but for leading this effort. So I'll say a few things. I will not pretend to know much about food is medicine. That is not my field. If you want to talk Markov chains, I'm happy to talk to you. But I wanted to say something about research and impact at Tufts and how this fits in that vision. At Tufts, we are a mid-sized university, about 1,000 faculty. And so we have to pick the areas in which we choose to go deep in and excel. And it's always dangerous for a university president to decide which areas this is. I only designate areas when I want them to die. Otherwise, you must look at where we already have strength, where we already have talent, and where we can use that to drive impact. The other thing we need to look at is how important is the problem. Sometimes in academia, we mistake the arcane and the difficult for the important. This is an important problem. Nutrition and food, nutrition as a substitute for medicine in a healthcare system that nobody will claim is efficient is particularly important. And so the combination of talent within the institution, importance of the problem, et cetera, made this an easy choice for this to be the first big initiative that I supported. And I couldn't be happier to see you all today and to be at its launch. With that, I may have overstayed my welcome, so I'm going to stop and thank you all and turn it back to Dari. Dari, congratulations.
Thank you so much, President Kumar. And the university is providing significant financial support over the next 5 years to really grow and build this area at Tufts and with a larger national network of partners. So we're really excited about that. Next, I'm pleased to introduce Provost Caroline Jenko. She is Tufts University's Chief Academic Officer. So she sets and guides all the priorities to advance our mission as a university that is student-centered and research-leading. I'm thankful to Provost Jenko and her team for their stalwart support and guidance throughout the development and launch of this institute. Provost Jenko.
Thanks, Dari. We actually started this discussion about food as medicine maybe 10 months ago, I'd say, something like that, where with Sunil kind of transitioning into the institution. And I'm thrilled at how quickly we were able to put it together, and we're actually formally launching the Institute. So I'm really thrilled to be here. Dari has a lot of energy and a lot of enthusiasm in this space, as I'm sure those of you who know him know. And so I'm just thrilled that we're able to actually be able to launch the Institute today. So one of the really important things about the launch of this institute is really that it's at a critical time when health disparities and lack of access to healthy food are significant drivers of poor health. I think all of you know that. We're really seeing tremendous momentum across both the public and private sectors in the US to really address this issue. And as many of you know, this is a major priority for the National Institutes of Health. We all know that Tufts is already recognized in this space, and food is medicine. And importantly, what we strive for here at Tufts, and I think the Friedman and Food is Medicine is a great example, is collaboration across both private and public sectors. All of you know, we like to say this all the time whenever we come to the Friedman School, that it's the only school of nutrition in the United States. And we really feel that the Institute is going to really broaden the impact of the Friedman School by collaborating across all of our schools, and in particular with one of our very important partners, and that's Tufts Medicine. And you'll hear from leadership of Tufts Medicine later this afternoon. So I just wanted to talk a little bit about what the Institute is planning on doing. I know Dari's going to talk a little bit about that. You know, there are kind of a number of different areas that the Institute is going to touch upon. And I think the focus will be to develop a center of excellence that can be responsive to the NIH and the call for work in this area. First, it's going to integrate food as medicine into electronic health records, clinical care pathways, and referral systems. Really, really important. It's going to provide interdisciplinary training for not only physicians, but scientists and healthcare professionals. It's going to lead clinical interventions like medically tailored meals, groceries, and produce prescriptions, combined importantly with the education on how to use those. It's going to engage with public health advocates, importantly, community members, and the private sector. And importantly, what the Friedman School does so well is to develop policy. And it's going to be policy that really advances food as medicine across the university and across the country. So we're really thrilled that many of you who are partnering with the Institute are here to join us for this launch. I know you're going to be working collaboratively over the next year and years ahead in developing projects, seeking joint funding, partnering with us on education and advocacy, and importantly, creating this network that really will have collective impact. So before I turn it back to Dari, I just wanted to thank all of you. This is really a team effort. It's a team effort with the faculty and the students in the Friedman School. It's a team effort with the School of Medicine, with our partners at Tufts Medicine, as well as our collaborators, both private and public across the country. And then finally, really a partnership with our communities. I think it's critical, and that is something that's really unique about Tufts. It's our ability to have an impact in both our local and our global communities. So welcome. I'm thrilled you're all here. I'm thrilled to see the next phase of the Food as Medicine Institute here at Tufts University.
Thank you, Provost Jenko. Next we're going to hear from two remarkable and dedicated deans. First, you'll hear from Dr. Christina Economos. She's the Dean of the Friedman School of Nutrition Science and Policy, and also the New Balance Chair in Childhood Nutrition. Having worked really closely with Dean Economos in a variety of ways over nearly a decade now, I can think of no one better to be leading the Friedman School in its mission of creating future leaders, real-world impact, and trusted science. Dean Economos.
Welcome, everyone. So my role is to welcome you all to the Friedman School and the launch of what I think is the first, but will definitely be the best, Food as Medicine Institute. So as you heard, we're the only school of nutrition in the country, and now we have one of the only, if not the only, Food as Medicine Institutes. And I can't think of a better place to build something like this. We have a reputation at Tufts as being entrepreneurs. There's an incredible history and entrepreneurial spirit at the university. I'm a builder, Dari's a builder, and I think you've seen both of us, if you know us, build things through the years, and I know that this will be incredibly successful. And the launch of the center is really an important step in our ambitious strategy here at Friedman to enlarge our research and training portfolio and to integrate evidence-based food and nutrition science into healthcare, and importantly, to inform policy at the national level. And the work of the center will help link our health sciences schools together. We have an incredibly rich campus here with multiple schools, and you're going to hear from the dean of the medical school, but this will go beyond and really link all of our schools and provide opportunities for our colleagues and students on the Medford campus to get involved as well. And I think not only high impact research will come out of this, but also opportunities for experiential learning, for working with people on the ground, doing community engagement, learning from people with lived experience, and training to achieve cross-country impact. So I really look forward to supporting the faculty, staff, and students to build this institute, supporting Dari and working with him every step of the way. And I think it really is a moment where we're finally valuing food and nutrition in our public health system and in our healthcare system. And I'm really excited in terms of the future together. Thank you.
So next you're going to hear from Dr. Helen Boucher by video. She was not able to be here in person, and so she sends her regrets. She had a previously scheduled trip and is going to be giving recorded remarks. She's Dean of the Tufts University School of Medicine, and she also plays a role across the larger Tufts Medicine Health System as the Chief Academic Officer, so both integrated into teaching and clinical care. And in her own work and in her role, I think, as a leader at the Tufts University School of Medicine, Dr. Boucher is a champion for advancing health justice and addressing the healthcare inequities that plague our nation. And so I welcome remarks from Dr. Boucher.
Congratulations, Dari, on the launch of the Food is Medicine Institute. What an exciting and noteworthy step forward for Tufts and our patients. I applaud your vision to advance science and translation for a food system that is nutritious, equitable, and sustainable. We know that poor diet causes over 300,000 deaths from cardiovascular disease and diabetes, and 80,000 excess deaths from cancer every year. In our state of Massachusetts, 1 out of 3 face food insecurity, and these problems are much worse in marginalized populations. Tufts University School of Medicine and Tufts Medicine are excited to partner with your institute and team to decrease the burden on our healthcare system and deliver care in ways that include nutrition interventions that are optimal for patients and impact outcomes. This includes educating our workforce in health justice and healthcare delivery and implementation science. We are already collaborating to recruit experts in nutrition science, community engagement, and more. Once again, congratulations on the launch of this great institute. Have a great meeting.
So you've heard a lot about kind of the background of why we think this is important, but I want to just spend a few more minutes before we turn to our really exciting panels to tell you a little bit more about the Institute and why we're creating it. And I think one of the most exciting things that's happened is as we started to discuss this before today's public launch with colleagues and partners and collaborators and funders, there's been so much internal and external interest in the Institute and in working with us. And that's good to hear because sometimes you get really excited about something in your own little bubble and nobody else cares. As the president said, the arcane and the difficult may not be the important. But I think in this case, this is also really important. And this incredible external and internal enthusiasm, I think, has supported that, as reflected by the people who are here in the room and those who are online. And so, as we think about food as medicine, there's several ways to think about this. But the way the Institute is going to approach this is to think about food-based nutritional interventions integrated into healthcare to treat disease and advance health equity with supportive policies and programs at the population level and in federal nutrition programs and so on. But really, the core focus is how do we actually get food into healthcare, nutritious, nourishing food into healthcare. And so first, thank you to our supporters, to those that have supported us to get here and continue to support us now. All of the organizations and funders listed here have provided support, funding support in different ways for the work of the faculty of the Institute. And we would literally not be here talking about this without them. So very, very grateful to all of the funding supporters here. Why do we care so much about this? Because this is such a major cause of death. As Dr. Boucher said, over 300,000 deaths from cardiovascular disease, over 80,000 deaths from cancer. If you add deaths from other conditions, over 500,000 deaths per year in the United States, directly attributable to poor nutrition. So 10,000 Americans dying a week because of poor nutrition. And what this graph shows is an analysis that we published looking at some of the top nutritional causes of poor health. And you can see there's things like low fruit intake, low vegetable intake, low intake of nuts and seeds, high sodium, high sugar-sweetened beverages, and so on. The real point I wanted to make here was that I sort of highlighted what are deaths from harmful factors, from having too much of bad things, and what are deaths from insufficient protective factors. And there's more deaths from insufficient protective factors than from excess harmful factors. That's really important because the way we've approached food in the last 30 years with the obesity and diabetes epidemic is something negative. It's something that we have to worry about and get concerned about and have less of and reduce and limit and restrict and tax and have warning labels. And that's true for some limited things, like maybe sugar-sweetened beverages might meet all of those metrics. But once you get beyond sugar-sweetened beverages and maybe really high sodium foods, those kinds of policies don't work to increase the intake of the healthful foods. And that's really what's missing. And that also restores a positive relationship of people with food, restores a positive relationship of people with farms and farmers and grocery stores and the people supplying the food. We don't have to have a negative adversarial relationship with the food sector that's feeding us. There should be a positive, nurturing relationship with the food sector. And so food as medicine is really about the blue, right? How do we get the healthy food to people that need it most? And on top of poor nutrition and all of the deaths and disability and suffering from poor nutrition, there's also, of course, dire and very unequally distributed food insecurity in our nation. And food insecurity isn't exactly the same as poor nutrition, but they overlap quite a bit. Those folks who can't access, pay, afford, get to, be able to prepare healthy food also often have the worst nutrition and the highest rates of diet-related diseases. And we talk a lot, and we should talk a lot about the lived experience of families with hunger and food insecurity. And those same families have lived experiences with diabetes, with amputations, with renal failure, with heart failure, with blindness. These are challenging diseases that I see as a cardiologist. And so we have to also think about this. And what's exciting is food as medicine addresses both poor nutrition and food insecurity. And there's very few interventions that I think can have that sort of double benefit. And I'm showing you now a map of the US rates of diabetes. And look at the overlap, right, between food insecurity. And there was another couple of maps I found on poor quality diets. Again, a real overlap here. Not a coincidence that the same areas of our country that are suffering from food insecurity and poor nutrition have the highest rates and highest suffering from diet-related diseases, in this case, diabetes. And the societal costs beyond the individual people and the individual families and their personal and suffering, the societal costs are incredible. And so from one analysis from Tufts, an estimated 750,000 Americans died in COVID-19 that wouldn't have died if we had a metabolically healthy population, because diabetes, obesity, hypertension were the top causes after age of death and hospitalization with COVID-19. So we lost 750,000 citizens because of metabolic disease during COVID-19. And if you put together the economic costs of food insecurity and poor nutrition, and this is an analysis from the Rockefeller Foundation, we have Devin Clotel from Rockefeller here, they published this great report. It's estimated that $1.1 trillion is lost in the economy every year, trillion with a T, way more than Congress is arguing about in budget discussions and things and how to change the budget. $1.1 trillion a year is lost from economic costs of healthcare spending and lost productivity from poor nutrition and food insecurity. And so food as medicine is not going to be the only answer to all of these problems, but it's one core answer. If I had to pick sort of a top 10 things to do to address everything I just discussed. Food as medicine is definitely up there and probably up there in the top 3. And this is one way to envision food as medicine. It's a pyramid of interventions with at the top the most intensive interventions like medically tailored meals, fully prepared meals. You're going to hear from a patient who's received these, down to produce prescriptions if somebody is not quite that ill but can shop and cook, getting healthy produce. You're also going to hear from a patient who's been involved in these programs, down to improving our federal nutrition programs and thinking about population level programs. All of this integrated into healthcare and healthcare systems with nutrition and culinary education. And so this is not some crazy pie in the sky idea. This is actually starting to happen, and this is what's really exciting. As I mentioned and has been discussed, food as medicine is not just a medical treatment. It's a medical treatment that can advance health equity. And as a cardiologist over my career, I've seen so many incredible advances in cardiology. Valves that can be put in through veins, new drugs, new stents, new devices, pacemakers, all kinds of changes in critical care. Now, all of those innovations have been remarkable and have saved lives. And there's always remarkable disparities in who receives those interventions. And the folks who need it the most often receive those interventions the least. And so we are improving health, but we're also often worsening disparities with most innovations in healthcare. Food as medicine is exciting because it's the first real innovation I've seen in my career, meaningful major innovation in healthcare that can actually improve health and reduce healthcare disparities by going to people and focusing on people with social needs, food insecurity, financial strain, other challenges. And as already mentioned, it also addresses food insecurity and nutrition insecurity, which is a wonderful, amazing 1-2 punch. Now, this is not yet as well established, and this needs more work and needs more thinking, but food as medicine can also, if done right, advance other priorities we have for our nation, advance priorities around strengthening local and regional food systems, supporting local farmers, even prioritizing and supporting certain farming practices like regenerative farming practices. And so there can be this beneficial loop of beneficial forward loop of positive progress for not just health and the economy, but also for farms and for our food sector. And if this sounds, well, like could food as medicine really do all that? I mean, remember, healthcare is $1 in $5 in our economy. We're not talking small change. $1 in $5 that we all spend on average goes to healthcare. So if we take a small portion of that and turn it toward food as medicine, there are many, many downstream potential benefits. And as I said, this isn't just us thinking about this. There's many organizations, many government policies, many actions going on across the nation, from clinical societies to President Biden and his national strategy, to healthcare organizations, to entrepreneurs, to nonprofits. There's so much going on in this space. And most of what's on this slide is like the last 2 years. So this is its incredible, incredible acceleration of food as medicine in the nation. And so I'm really excited about the Food as Medicine Institute. Provost Jenko talked about what we're going to focus on. We're going to focus on clinical research and implementation, education and training of the next generation of scientists in this area, ways to improve patient care in food as medicine, community and private sector engagement and policy development. And we're not starting from scratch. In green is some examples, just a handful of examples of the many projects that were already ongoing and accelerating at Tufts around food as medicine. And so I just want to end by thanking not just our funders, but also our many partners. And I apologize if this list is incomplete. I made the slide this morning, thinking about all of the great, thank goodness for the web and logos, all of the incredible partners that we work with that have really helped move this field forward. And so this is, again, just a cross-section of the groups that we're working with and how exciting it is. And you're going to hear from some of them today during the panel. So thank you for your interest. Thank you for being here. I really look forward to working together to advance food as medicine, and I'm looking forward to the rest of the day. Thank you.